You got the results back, and everything is normal. And you waited for the relief to come, but it didn't. Maybe you felt better for a few hours, maybe even a day. And then the thought crept back in. What if they missed something? What if the test wasn't the right one? What if normal results just meant that they haven't found it yet? And so you go back, or you Googled it, or you checked your body again, looking for that thing that must be there because something has to explain this feeling that you have and why you feel this way. And here's the part that makes it even harder. The symptoms are real. The chest tightness is real. The headaches are real. The dizziness, the racing heart, the strange sensations that come out of nowhere, they are real. You're not imagining them, and you're not making them up. And anyone who's ever implied that you are has done you some serious disservice. But here is what nobody told you when they handed you those test results. The test was never going to fix it. Not because something is wrong with the test, but because medical tests are designed to find physical disease. And what you're dealing with is not a disease that shows up on a scan. It's something that lives in the relationship between your brain, your body, and the meaning you are making out of every sensation you feel. And there are actually two conditions that explain what it can look like. Two conditions that are related. They often overlap, and they're both wildly underdiagnosed. And most people have never even heard of them after years of suffering. The first is health anxiety, sometimes called illness anxiety disorder, and the second is somatic symptom disorder. This is where real, genuine physical symptoms are accompanied by disproportionate and persistent anxiety, thoughts, and behaviors around those symptoms in a way that takes over your lives. They are not the same thing, and understanding which one you're actually dealing with or whether both are in the picture, that matters enormously on what treatment can look like and why. Now, Ken Goodman has been on the show before and is a therapist who specializes in health anxiety and is the author of the Health Anxiety Toolkit and Video Toolkit. Ken has spent his career sitting with people who have been exactly where you are, exhausted from all the testing, the Googling, the reassurance that never sticks, the symptoms that no one can explain, and helping them finally understand what's actually happening and what actually helps. Today, we're getting to all of it, why the tests will never be enough, what health anxiety and somatic symptom disorder actually are, and how to tell them apart. Ken, welcome to the show.
So thank you so much for being here, Ken. I am so excited to have this conversation. It has been a conversation and a question that I get asked all the time. So let's first get into the clinical side of what's going on here, really talking about the human cost. What does it look like or feel like living in this cycle when a person is stuck in this situation?
Well, first of all, thank you for having me again on your podcast. I really appreciate being a guest. Boy, when you have health anxiety, somatic symptom disorder, it's actually called illness anxiety is the official title. It is debilitating because the cycle is one thought, one symptom that seems to go away, but it's followed up by another one. The body is very noisy. So it's constantly triggering you because that's the way the body works. We're not perfect. And so anytime there's a physical sensation, something odd, something unusual, something different, your mind tends to drift to the worst case scenario. And then you perseverate on it, dwell on it, you focus on it, you Google, or nowadays ChatGPT, and you start learning about diseases you didn't even know about. And then you get super anxious. And oftentimes, the more anxious you feel, the worse the symptom gets.
Yes.
It's a horrible cycle. And what you're feeling is real. The symptoms that you're feeling are real. The interpretation, however, is wrong.
That's a hard cycle to be stuck in, though.
Very good.
Especially, I've had a lot of health anxiety clients say, like, if I was afraid of airplanes, I could at least avoid airplanes, but I can't avoid my body. I'm walking around in my exposure all day long, and
Well
it's
done.
exhausting. And so let's get straight to sort of this main concept.
Let me say one other thing, because you're right. You could avoid going on an airplane. You could avoid going on elevators. If you're afraid of clowns, don't go to the circus.
Yes.
But you can't avoid this because not only is the body noisy, but so is the world.
Yeah.
You're going to drive by a hospital. You're going to see a pink ribbon that represents breast cancer. You're going to hear a story from a coworker who had a cousin who just got diagnosed with brain cancer.
Yeah.
There's no way to avoid it.
No.
And it's unpredictable.
And let alone if you log on to Facebook and you get into some Facebook group, before you know it, you're learning about some terrible catastrophic thing, and you can't backpedal from there. You can't unknow what you just read. So it
GoFundMe, for
yes,
somebody that's
yes.
diagnosed with something fatal. Yeah.
Exactly, exactly. So again, I really want you guys to understand who are listening. Most people watching this and listening have never heard of the term somatic symptom disorder. And some of them have been in the mental health system for years. Can you walk us through the difference between what is health anxiety versus what is somatic symptom disorder?
It's very similar, and people will often have elements of both. And in my book, I talk a little bit about somatic symptom disorder and health anxiety, but I really treat them as one. But somatic symptom disorder is a preoccupation with a physical symptom. You may not think that you're going to die from it. You're not worried about the end result. You're just preoccupied with that physical symptom. But most of the time, people have a little bit of both. Like they're preoccupied with the symptom and they're worried. They may not be worried they're going to die from it, but how long is this going to last? Is it going to get worse? Why is this happening?
And what about illness anxiety? Like, how might somebody differentiate in the day to day what is what? Again, like I've heard so many patients and students say to go to the doctor to get the test, and the doctor says, this is just your anxiety, can feel so demoralizing and so
Yeah.
embarrassing or shaming or they feel judged and they kind of feel lost because they're like, well, what do I do? How might they be able to differentiate what is what? Like you said, you think they're very similar, but can you sort of explain what they might look like in comparison?
To be honest with you, the layperson doesn't need to know the exact definition between what is somatic symptom disorder and what is health anxiety. It doesn't really matter that much. You're going to treat them both the same. In both situations, it's a preoccupation with that physical symptom. And the more you're preoccupied with those physical symptoms, the worse it's going to get. The physical symptom is real. Like whatever you're experiencing, you're actually experiencing it. But the more you focus on it, the more engrossed you become with it, whether that's behavioral or mental preoccupation, the longer it's going to last and the
Mm.
worse it's going to feel. I just spoke to someone 2 days ago. And when I met her, she had joined my health anxiety group. She had been having health anxiety since she was 14, and now she was 40 when she joined the group. And she joined the group because she was having what was called burning mouth, extreme pain in her tongue, chronic, all day, every day. And she went to multiple doctors, all different kinds of doctors. None of them had answers. And so she came to me and thought, well, maybe this is health anxiety. So we talked about radical acceptance, accepting that you have burning tongue, and then learning that it's not dangerous and to not be afraid of it. Because the more fearful you are of the symptom and the more preoccupied you are with it and trying to change it and make it go away, the longer it's going to last. So for 3 years, she was seeking medical interventions, very anxious, very fearful. On the third year, after she was in my class, she decided to try this mind body approach where she started looking at the idea that, okay, maybe it's my mind that's creating this. And sure enough, now I didn't know this because the class had ended and she was still having burning tongue. But she said it took about a year, an entire year, for it to go away. So she was using this approach, this acceptance, not being afraid of it for an entire year. It slowly went away. And she said now she doesn't even consider herself having burning mouth because it's so small. Most of the time she doesn't feel it. Most of the time it's like a 0.5, but it took a whole year. There was no medicine involved, no surgery, nothing.
No
It just
tests.
No tests. It just went away when she stopped being afraid of it, stopped caring about it, just accepting it.
Mm,
But it
mm,
didn't happen overnight. It takes time
does.
for the body to quiet. It
Yes.
takes time.
It reminds me of a conversation I had with Stephen Hayes, where he talked about how he was diagnosed with severe tinnitus, or in Australia, we say tinnitus. And he said he would spend all this time like resisting it, resisting it until he practices this idea of accepting a sensation, not catastrophizing it, not trying to, figure out how to get it to go away or avoid it, but just letting it be there. And he's like, I still have tinnitus. It just doesn't bother me anymore.
Mhm.
And so I think it's even for folks who continue to have a sensation, even if it doesn't go away, their suffering about it goes down.
Yes. And in my book, it's called the Health Anxiety Handbook and Video Toolkit because there's all these QR codes that link to videos. And one of the videos is my niece, who's now 29, but there was a surgical procedure to fix something on her eye, and the surgery went bad, and she ended up having double vision. So everything she saw was double vision. And searching for other medical ways to correct that, nothing happened. I mean, they patched her eye, it never went away. But she adjusted to it. So even though she still has double vision, because it's a medical thing, it's not psychological, it was medical, she was still able to adjust to it. So she's able to drive, she's able to do everything anyone else could do. But she had to at first accept the fact that she had double vision. So even if something is medical, you can still adjust to it. The good news about these psychological disorders is that the more you accept them, the more they go away. The less fearful you are of them and the less you focus on them, the more they go away, to the point where they can go away completely.
So let's talk about that, because I think that's where a lot of people get stuck. Is they have physical symptoms, they have headaches, they have stomach aches, they have rashes, like all of these that are under the umbrella of symptoms of anxiety, but also could be symptoms of cancer if they've Googled it, right? Or now we have the problem of people chat GPTing their medical advice, which is a whole episode in and of itself. But they're actually experiencing this, and they're stuck with this moment of, do I practice what Ken and Kimberly are saying by accepting it? But the side effect of that, the risk of that, is they're going to have an intrusive thought that, what if I'm being irresponsible? What if this is the first symptom of cancer and I use the skills and that is what causes me to have some catastrophic? Like, I've never had a client who hasn't had that fear, that what if using these skills impacts me from getting the medical care I need? What would you suggest, whether they have somatic symptom disorder or health anxiety, illness anxiety? What would you say to them in that circumstance?
So I think the first thing is you have to learn about what is actually health anxiety. So in the book, I describe it. And if you see a pattern of health anxiety, like if you've had it for years and you see that you've had one episode after another of imagining catastrophic fatal illnesses and they haven't come to pass, and there is a pattern there, a persistent pattern of worrying about fatal diseases, exaggerating symptoms, then you know you have health anxiety, right? So you can say, okay, I have health anxiety. That's the one thing I know I have. I haven't been diagnosed with cancer. I haven't been diagnosed with ALS. I haven't been diagnosed with heart ailments, but I know I have health anxiety. I have to treat that first because I know I have that. So if you treat the health anxiety first, even though it could be cancer or something else, that's the best way to go. So first and foremost, I'm going to treat the health anxiety. If then the symptoms persist or they get worse, okay, now we'll go to the doctor. But I have to treat what I know I have first.
Yeah. You answered almost the question I was just going to ask, which is when to know to go to the doctor.
Oftentimes people with health anxiety will fall into one of two camps, and usually they fluctuate. Either they go to the doctor too often or they avoid the doctor completely.
Yes.
And oftentimes they will flip-flop. So, and you have health anxiety and you seem to want to go to the doctor immediately, there's an urgent need to know. So whenever there's something uncertain, you want to know now. I need to know quickly. I need to figure this out. So you make a doctor's appointment prematurely instead of just waiting, because most symptoms will just fix on their own. Most symptoms will just go away on their own. You don't have to do anything. And if you look back over your history and you think of all the symptoms you've ever had, how many of them actually needed medicine to go away? Most of the time, these symptoms just go away on their own. So if you give it a little bit of time, I talk in my book about the 3-week rule. And I also talk about exceptions to the 3-week rule, but it's like, let me just kind of wait 3 weeks. If the symptoms are going away, great. If they're getting worse, all right, I'll make an appointment and go to the doctor. But let's just sort of wait. I don't need to know now. Now, that might be different for heart, but everything else, I can just wait. You can just wait and see what happens.
Yeah. And I think that that's the interesting part. And I think you mentioned this earlier, is if you have health anxiety, you do tend to have extreme expectations on your body to not have symptoms. Like, I find that that's so much a part of the problem. Like, they'll be like, but I have a headache. And I'm like, yeah, humans get headaches. And they're like, but why? And I'm like, no, just because. Like, humans just get them. Like, it's a part of being a human. But I think that when there's health anxiety, every symptom feels like the beginning of a catastrophe.
Mm-hmm. Yeah, my working title for my book was The Noisy Body and the Fearful Mind, because the body is just noisy. I mean, don't expect your body to be perfect. I mean,
Right.
it's not perfect. It does all sorts of weird things all the time.
Yeah.
It's just that when you have health anxiety, you tend to focus on it, whereas the average person will notice it and they'll just move on to something else.
Yeah.
But when you have health anxiety, you immediately, it grabs your attention. What is that? Okay, now there's a need to know. So now you got to look at it. You got to examine it. You got to go online and do research. You got to take pictures of it. You got to ask for reassurance. So now the more you focus on it, the worse it's going to get. The whole idea is to notice it, remind yourself, I have health anxiety. Let's move on
Yeah.
and
Yeah.
not focus on anytime you give some energy to something, time to something, it's going to grow. Like imagine you want to grow a vegetable garden. So you think to yourself, all right, I don't know how to grow a vegetable garden. I'm going to go on YouTube and I'm going to learn how to grow a vegetable garden. And you spend hours on that. And then you go to Home Depot and you ask, for advice and you buy all the equipment and you come home and you till the soil and you nurture the soil and you pull the weeds and you build a contraption so the rodents can't get in there. And what's going to happen in a few months? You're going to grow vegetables. But if you take the seeds and just throw them on the ground, nothing's going to happen.
Right.
The more energy and time, the more it grows, whether it's vegetables or your thoughts.
Yes. You're funny. You're just describing me because I literally have been building a vegetable garden for the last few months. And it is true because we are literally, I use this example with clients all the time. Like we actually have multiple beds. But if I just chose not to water one of them, those plants would die. The ones who live are the ones that I'm watering, that I'm putting my attention on and I'm caring for them. So I think that that's so true. Okay. So let's talk about strategy here. Someone has health anxiety, but they have their yearly physical coming up, or they have actual, illness or condition or something going on in the background where they do need to go to doctors. How would you encourage them to navigate that process from start to finish, all the way through to going to the doctor? How do you talk to the doctor? How do you manage the anxiety of tests? Do you want to sort of walk us through that process?
Yeah. So in this book, I have 3 chapters dedicated to going to the doctor, tests, scans, it covers all of that. So, but briefly, it's hard to cover this briefly.
I understand.
There's a reason why people avoid the doctors. I call it a love-hate relationship because you want to get the reassurance from the doctor, but going to the doctor is very triggering, just even walking into the office, because the doctor is going to say something vague that you're going to then misinterpret. Because the doctor is not going to give you, or rarely is going to give you, conclusive evidence that you're perfectly fine and safe. They're going to say, right now, it doesn't appear to be you have cancer. But in your mind, you're going to interpret that it doesn't appear to be cancer. Well, does that mean it could be cancer? Or the doctor might say something like, you know what, you're fine now. You're all right. Why don't you come back in 6 months? And you might think, well, why do I have to come back in 6 months if everything's fine? So
Right.
your anxiety is always going to flip it around.
Mhm.
So you always have to be aware. So in the book, I talk about, well, how to prepare for these comments the doctor is going to make. How are you going to prepare for when the doctor says, well, it doesn't seem to be anything, but why don't we do a CT scan just to make sure? So now you got to go for a CT scan, which scares the hell out of you. So oftentimes people will just avoid going to the doctor because they don't want to deal with it. And then the longer they avoid going, the more they start to think, well, I haven't been to the doctor in 3 years. Maybe something is wrong. You can't avoid, and you have to go to the doctor. You got to go to your annual physicals. You got to do all that stuff. And you also have to learn the strategy of how to approach these visits without freaking out about anything the doctor might say or might recommend.
Yes. And I always say to clients, but you can actually give me your feedback on this.
Yeah.
I always say to clients, you are to go and just answer the doctor's questions. Don't come at them with what you think it might be. I have so many clients who come in and they'll say, I have had headaches and I've also had a lot of anxiety lately. And I read online that it could be. Now you're kind of dangling in front of the doctor all of these things. And legally, he can't ignore you, right? He's on the hook now legally. So I always say, just go in and let their doctor do their job of asking the questions instead of you feeding him your own doctor strategy.
Yeah, I can see why you would say that. I actually advise people to share their worry. So if you're worried about brain cancer, say, I'm worried about brain cancer, because the doctor doesn't know what you're worried about unless you tell
Mhm.
them. And they might be looking at it something different and they're not even aware that you're worried about brain cancer. So they can address that. So I usually tell people to share what you're worried about because then the doctor can address that worry. I also tell people don't ask a lot of questions
Yes.
because the doctor doesn't have all the answers to everything.
But that
They
makes them so upset because they want the answers. They want certainty.
Right. So don't ask a lot of questions. Don't ask about side effects to medicine. Don't look up side effects to medicines. But yeah, it's challenging. I usually recommend making sure that you actually have a primary care doctor and getting to know that person and making sure that person is patient and understands a little bit about health anxiety. But too often people don't establish relationships with their doctor. They're just going to urgent cares. And
Yeah.
so it is really important that you actually have a good relationship with a doctor that
Yeah.
you trust, who has good bedside manner.
Yeah. Can you share a little bit about your advice to tell them about your worry? So let's play it out. So let's say you were afraid of a brain tumor and you were going in for headaches. To what degree would that be giving the doctor just giving you reassurance? Like, can you help someone understand who's listening? To what degree do you share your fear? And when does that cross over into you just needing reassurance that you're not having a brain tumor?
So I think sometimes therapists will say reassurance is not good, but normal people want reassurance. When I say normal people, I mean people without health anxiety. They want to be reassured that they're fine, right? So going into the doctor because you're worried about something, whether you have health anxiety or not, and the doctor's saying now you're okay, that's fine. The problem with reassurance is if it's a compulsion. Like you have to call the doctor again, you have to send an email, and you need reassurance from your spouse. That's the problem with reassurance. But if you need reassurance to find out you're okay, that's fine. There's nothing wrong with that.
So I think what you're really saying to the listeners is getting assurance is fine, but reassurance is where we draw the line or where you want to be careful. If you're finding you're asking the same question more than once, or you're asking the same question in a sneaky different way, or even a lot of times I find if let's say you're going for assurance, like I'm afraid of this, and the doctor says, no, your headaches are normal and whatever. But then sometimes we might re-ask a question or even make a statement and be looking at the doctor to try and see their facial expression to see if they're anxious. Like I think that there is sometimes a physical checking we do of like, it's sort of like when you're on the airplane, you know how they say like, if you look at the flight attendants and they're not scared, you're probably fine. Like I
Mhm.
think what we do that as well with doctors. We look at them to see if they're scared.
Very much. And sometimes maybe they are a little concerned, but that doesn't mean their intuition is correct either.
Yeah.
I've had doctors like, yeah, this is concerning. We should check it. And then turns out to be nothing.
Yes.
But yeah, there's a difference between assurance and reassurance. And even asking again, like the doctor says, yes, you're fine. And but before you leave, you're like, so I'm okay. And the doctor says, you're okay. Okay, fine. Right. So you can leave it at that. You can
Right.
leave it at that.
Right. One last question before you tell us more about your book is okay, so if somebody does, let's just talk about pain, because I think this is important. Some people do have conditions or symptoms that are painful, headaches. Like I just went through a wild vertigo thing that I'd never experienced. Like that sucked. Like that was scary. It was
Mhm.
difficult. And I have all the skills. So I'm so grateful that I have already been trained to handle that whoosh of like complete craziness. But for those who are experiencing physical pain in relation to their, we talked about the somatic symptom part, what skill would you give them to help manage the physiological discomfort they feel? We've talked about not engaging in the anxiety, but what about managing the pain?
Yeah, good question. So in my book, I mentioned I have QR codes, and one of the QR codes is a group I conducted with health anxiety clients, and I had a guest on the show who is Dr. David Schechter, and he wrote a book called "Think Away Your Pain," and it was all about having pain that's manifested through the brain. There's no physical structure that's broken or damaged that's causing the pain. The pain is being caused by the brain. And so in the book, you can watch that video, but a lot of pain comes from the brain. As an example, phantom limb pain, a limb where and you're in war, and let's say your arm is blown off and you have no arm from your elbow down, but you can feel the pain in your hand, even though there's no hand there. Well, you can feel the pain in your hand because it's not coming from your hand; it's coming from your brain. There's another video that I have in my book that is it's like a rubber hand experiment where the experimenter trains the person to feel sensations in a rubber hand. So they're actually feeling sensations in the rubber hand that because their eyes are looking at the rubber hand. It's crazy. But it's just another example of how pain sometimes is actually amplified through your brain and not anything physical. But then again, you have to rule out the physical first. So, in all of these things we're talking about, you really have to rule out anything medical. So, whether it's a neurological thing or a pain thing, we got to rule out the medical first. If there's nothing medically wrong, then we have to start thinking that, all right, maybe this is a mental disorder that I am creating or I'm amplifying because I'm so anxious and preoccupied.
Yeah. It's sort of cool, isn't it? That, I think it's kind of cool that we have the science and those types of experiments that can confirm that.
Yeah.
Before you tell us about where people can get a hold of you, is there anything that we haven't mentioned today that you feel would be absolute crucial for listeners to understand, specifically if they are having somatic symptoms that haven't been given any medical reason and they have a lot of health anxiety or illness anxiety about that?
Get this book. You know, it's complicated. It's not easy, but I will say it's treatable. I started doing health anxiety groups for my clients before COVID. So once a month, we would get online, people from all over the US and different parts of the world. And when the group started, everyone was a mess. Everyone was terrified. And now, I still have some people that are still part of it. They're like, they're good. Like, this is a treatable disorder.
Yeah.
It's treatable, but you have to get the right kind of treatment. If you're not working with someone who specializes in anxiety and OCD, who has experience with this, it's not going to work. You
Yeah.
can't go to a generalist and expect to get better. You have to see someone who knows how to treat this, right? So probably the best thing to do is make sure that whoever therapist you're seeing, go to their website and see, do they only treat anxiety and OCD, or do they treat everything under the sun,
Yep. Yeah.
right?
Amazing. Yeah. Tell us about your book.
Oh my goodness, this has been a labor of love. Yeah, this is probably 2 or 3 years in the making, a health anxiety handbook and video toolkit. When I write a book, it's big. It's not just a book. It's basically a program because I have all these QR codes that go through the book, interviews with doctors, interviews with former health anxiety sufferers. In fact, in the first chapter, you'll see these 4 QR codes and they link to videos with 4 different people with different kinds of health anxiety. And it's so that you can understand, oh, this is what health anxiety is. But then each video ends with them talking about how they're doing now and that they did get better. So one person had worries about cancer, another person had worries about ALS and MS, another person had fears of heart attacks. And you just put your phone over it. And these videos, these QR codes, these people, you kind of follow them through the book. And as I talk about different treatment strategies, you can watch a video of them talking about this treatment strategy. Or I'll interview doctors, and the doctors will talk about, from their perspective, how they work with people with health anxiety and how the body is noisy. One of the people I interview, he's an ER doctor. He actually oversees like 40 ERs here in Southern California. And he talks about every day people are coming into the ER with things that they think are medical, but they're actually being caused by their brain, their mind,
Yeah.
right?
Yeah.
So the book is step by step. You learn about what health anxiety is. You learn about what the strategy of anxiety is. In other words, anxiety as a strategy. It's trying to keep you miserable. You have to understand how anxiety is doing that. And then I give you a strategy of how to overcome it. Once you learn that strategy, now you have to learn, okay, how do I implement this strategy? And then once you learn that, it's like, okay, now I need to learn, how do I deal with doctors? How do I make sure that I get to the doctor? Because you want to make sure that you're not only protecting yourself from fatal diseases, but you're trying to protect yourself health anxiety too. You're trying to find a balance.
Mm-hmm.
So it's all in the book. It's fantastic. Highly recommend it. You can go to kengoodmantherapy.com to learn more about it. You can also go to Amazon. It's available on Amazon.
Congratulations. This is so exciting. I so
Yeah.
celebrate anyone who writes a book. So it sounds like it's amazing. I cannot wait to get my hands on it. So
Yeah,
thank
and
you for
it's
being
a
here.
lot of, by the way, can I sorry to interrupt you? By the way, a lot of people are fearful of jumping into a self-help book, like on health anxiety, because it's all about uncertainty. Like, what am I going to read? Am I going to read about other people's fears and then take them on my own? No, I try to keep the book light, and there's humor in it. There's a lot of anecdotes and metaphors, and you will not do that. That will not happen. You'll come away feeling empowered and not so worried about your thoughts, because the whole idea is to stop worrying and start living.
Yeah.
That's the whole
Amazing. Thank you so much for being here. It's been such a pleasure to chat with you, and I'm really, really helpful. So thank you.
Thank you very much for having me. I appreciate it.